Thanks, CWC, for inviting me and sharing my opinion with and my experiences with everyone. As you know, I've been practicing OB/GYN for a while, so I just want to go back on. Let's start with the main topic right now. I'm supposed to talk about menopause. Now, the average age of menopause is 52. Second, what are the symptoms of menopause? Is vaginal dryness, hot flashes, sleep disturbances, mood swings, vaginal irritation, dryness, a burning sensation, and sometimes urogenital symptoms too, like you have difficulty urinating. These are also symptoms that could occur in menopause. What is menopause? If you don't get your periods for 1 year, that is menopause. The period while you're having like 6 months, 9 months, and then eventually you don't get your period for 1 year. So the period surrounding menopause is perimenopause, and you might get symptoms of the symptom that I mentioned even in perimenopause. Um, the only reason typically we treat patients is for two symptoms, which is pretty prevalent, is 50 to 60, 82% of patients, of women, they have breast hot flashes and vaginal dryness. Now, the goal of treatment is basically small dose for a small amount of time. And that's the main goal of how we look at treating menopause symptoms. Now, there are two types of treatment, and I am always for, if you could avoid hormones, extra hormone, that's great. Go for walks, go for meditation, and I'm sure they're going to talk about that after my session. Yoga, wellness, food items that might help in menopause symptoms, relieving menopause symptoms. So I'll talk about the medical treatment, and still I say small amount of dose for a small period of time. That's very, very important. Now, there are two types of hormonal treatment. One is non-hormonal. Non-hormonal in the sense of lubricants, vaginal creams, vaginal suppositories like vitamin E, vitamin D suppositories. You also get, these are medication that, well, non-hormonal treatment that could relieve symptoms. Sometimes I tell patients you can try little soya products also, orally soya product that might relieve your symptoms of menopause.
How does typically a woman know that she's in perimenopause? Because there can be symptoms that are similar to maybe some other issues or maybe menstrual issues. So
Right.
how does a woman know that she's in perimenopause?
So one is that if she gets a period like every 3 months and then 6 months, so it's kind of waning away, and then that is perimenopause. Yes, we can do some blood work also, which can tell us it's a serum FSH. We can do that as well, which if it is more than 30, 35, it's typical menopause. She could still be having her periods, but at the same time, if the serum FSH is elevated, it could indicate she is perimenopause.
Is it just the irregularity or could there be other symptoms?
There could be hot flashes. So even though she's not menopause, she could have in perimenopause hot flashes, mood disturbances, sleep disturbances, vaginal dryness.
Okay. So now you mentioned that a typical age is like 52 and perimenopause begins early on. So how early does it begin?
Sometimes it's about a year, 2 years. So that's about 2 to 3 years, even before you finally reach menopause, you could have these little symptoms occurring slowly, slowly, slowly.
Okay. So please go ahead.
Yeah.
Cover the rest of the things.
So the hormonal treatment would be two types. One is estrogen and progesterone combinations, and the other one is only estrogen. Um, Estrogen, again, the hormonal HRT increases the risk of, now patients ask me, what are the risks of taking this? Yes. One is increased risk of thromboembolism, that is clots. That is pretty, incidence of that is about, I would say it increases with age, as well as it increases with about 1.2 to 1.5 fold increase uh, compared to non-users, the incidence of clots or thromboembolism. Again, if the patient has got morbidity, like increased risk factors, obesity, fracture, immobilization. They might have thrombophilia genes, that is factor 5 Leiden. There's certain tests that we can do to see are they at risk of having a stroke or thromboembolism. So these are the patients you would want to avoid hormone replacement therapy.
So,
So
question there is, I mean, at what stage or that a HRT or a hormone replacement therapy is suggested? What are those cases
it's
when somebody
necessary.
needs it? Yeah.
Yeah. Say if hot flash, a lot of people don't have any of these symptoms. They're fine. They literally ride through menopause without any concerns.
Mm-hmm.
But if these symptoms are causing difficulty in your daily living,
Mm-hmm.
like you get up about 6, 7 times at night, hot flashes, you're not able to concentrate, you're not able to sleep, then and vaginal dryness. So two main indications are vasomotor symptoms, hot flash and vaginal dryness. If these are the two things that's really affecting your daily life, yes, go ahead and take it.
At what point do you assess that, yes, this is very difficult for a certain woman to kind of deal with and maybe suggest HRT? Or are there other ways to kind of convince not to go for HRT, but there are other mechanisms to deal with it?
Right. So that's what I say, go ahead and try like food items like soya, and I'm sure they're going to go through on the herbal treatment. There's so many herbal treatment that's available out there, which I think they'll follow up with a talk after me. Meditation, um, exercise, excellent. I always prefer that patient do all of these before meditation, running, jogging, exercise, open air, you know, diet modification. So if this doesn't work,
Mhm.
then I would say, and still, then I would recommend hormone replacement.
Okay. So, I mean, menopause or perimenopause is a phase of life, and a
Yeah.
lot of women kind of struggle or get depressed or feel that, oh, I am now at a juncture where it's a downhill. How do doctors or like doctor like you kind of help deal that? Because a lot of women feel that I have menopause issue, and I feel that it's not an issue; it's kind of stage of your life, and every woman has to go through it. So how do you address that with any patient that comes to you?
So I typically say, yes, is it affecting your daily life? And if it is, then go ahead and do the non-hormonal treatment, as I mentioned. And if you still want to go ahead and take hormone treatment, then I would recommend, you know, the hormone HRT. So
Mhm.
everybody, I leave it to them to decide about how are they able to cope
Mhm.
with hot flashes. Some of them say, yeah, we just get it once in a while. And I'm like, okay, you don't need it. You don't
Mhm.
need hormone replacement therapy. And I'm able to do my daily work. Then I wouldn't recommend hormone replacement. We don't want to give patients hormone replacement if not necessary, remember.
Right. Right. With this phase, the hormones are kind of depleting. They are on the downhill or downside. What are the things that a woman has to watch out for in terms of health? Is there any supplements that they have to continue, or does the body automatically kind of deal with it?
Well, yes. Usually the body automatically deal with it because the peak of these menopause symptoms is really a year after your last period. That's when it peaks and it slowly subsides over the next few years. So by the time they're 57, 58, they typically may not even need any hormone. They might not have any symptoms. So in that case, I say multivitamins, vitamin E, vitamin D, these really help in and help relieving the symptoms.
So we generally hear that the bones become weak, there is a chance of breakage or fracture. So why does that happen? I
That is
mean,
because the estrogen level is so low, these chances of the patient of the bone loss that causes bone loss, bone osteopenia, that is decreased density, and then eventually bone loss. So
mhm,
we always encourage them for weight-bearing exercises, vitamin D supplements, calcium supplements, very, very important. Once you reach your in perimenopause state, we recommend starting it. And then there's also a DEXA scan that we do at 65 to see how much is the bone loss.
mhm,
Vitamin D levels, which typically we do it at all annual examinations, is another important thing to check.
mhm.
Yeah.
Good to know. Okay. What else should we kind of
So I think those are the main thing. Now there are hormones, I would say, um, the different types of hormonal medications also we have, they're called as the bioidentical hormone. Now remember, there's bioidentical hormones and there are compounded bioidentical hormones. Bioidentical hormones are the ones that we can is available now in terms of estrogen and estrogen testosterone progesterone combination and testosterone as well. So these are the forms that it can come in the form of gels, in the form of sprays, vaginal inserts, and these are all FDA approved
mm,
biodegradable. So the other one is a compounded. A lot of information out there about compounded that is made by the pharmacist is typically like, and that is not yet FDA approved as far as I know. But a lot of these compounded identical hormones, bioidentical hormones are made by the pharmacist. So say if a patient, and we would say only if a patient has an allergy, say a peanut allergy, and your bioidentical hormone has a peanut, they use these as mediums for the gels, etc., then we could say, okay, well, maybe have it compounded to a certain method so that to avoid the peanuts in that uh, prescription, in that medication. So they have pellets, they have compounded bioidentical, which we don't recommend that because it's not FDA approved
mhm.
at this
Okay.
point. There's lots of information out there. It's just coming up, but the safety and efficacy is not known. Simply because you really can't control the amount of hormones going into the body.
Mhm.
They
Okay.
have injectable pellets, vaginal inserts as well.
For example, menopause leads to weak bones, and we know that there are some supplements that you talked about. But there are other things that also impact a woman, like hair loss, maybe
Mhm,
mood swings, depression.
mhm.
So, have you seen more and more South Asian women coming, or in your medical practice? I'm sure you are also dealing with non-South Asian women. Have you seen any difference in how one segment deals with versus the other?
No, I think it's across the board. Everyone is having these symptoms, hair loss, mood symptoms, sleep disturbances, the estrogen when it goes down. Now, again, I tell them, please check your thyroid levels. Please check, these are the one of the causes. Nutrition is, of course, very important, and thyroid levels to reduce if there's any evidence of thyroid abnormalities, you need to correct that for hair loss.
Mhm.
So yes, a lot of people do have this. And well, estrogen may or may not, hormone replacement therapy is not indicated for treatment of hair loss. So that's a normal aging process. HRT is not one of the indications, for hair loss is not one of the indications for that. Yeah.
Have you seen cases where I mean a woman is it's very difficult for her to deal with it, and on the other side also the family probably doesn't know why somebody's having mood swings or going through a certain phase.
Yeah.
Have you uh, had to advise anything to the family, or is it just to the woman how to deal with it? Just I'm interested in knowing how family plays a part in this.
Well, so hair loss, okay. Could it be just hormonal? Could it be thyroid? Could it be water, change in shampoo, change stress? Of
Mhm.
course, stress. So stress is a factor too. And I always counsel them along with the family to say, if there's any evidence, you want to just deal with that first as well. Stress, bad food habits,
Mhm.
nutrition is very important. That those are main basic things that we need to check on. Um, and yeah, I do counsel them on that. That's definitely important. It's a holistic approach, right? Yes.
Correct, correct.
Yeah.
So, any other advice for the women? How to deal? Any tips, tricks? You talked about HRT, you talked about the symptoms from perimenopause to menopause. It can be 1 year, 2 years. For some people, it might be longer. And also, in many cases, we won't know whether we are really in perimenopause or is it something else. So I'm sure that when the woman goes to a doctor, there are various things that you check to ensure that yes, it is perimenopause versus some other chronic illness. Anything that you would advise the attendees on this call, or anybody who's going to watch this interview in future.
Right. So sometimes, you do have cases where it's premature ovarian failure. That means the ovaries has kind of failed before really 52. And so those are the cases that we can always kind of check on the blood work and make sure that have they reached premature ovarian failure. And those are the ladies who might have, early menopause symptoms, like in late 30s, early 40s. And so those are the blood work that we can do to confirm it. So
Mhm.
whenever they go in for the annual exam, there are blood tests that we can do just to see whether they do fall in the category of one, premature ovarian failure, and second is perimenopause.
Mhm.
So
Okay.
this is something the patient should definitely, women should address with their with their GYN
Uh-huh.
about these symptoms when they have it.
Got it. Monisha Bhatia, she's asking, I'm having a lot of sleep disturbances for uh, falling asleep, and I'm sometimes hot and sometimes cold. I had UFE procedure 2 years ago, and the procedure went fine. Does a woman still go through the menopause symptoms, which I'm assuming we all do, but it is still a puzzle at times? And any solution on this? My periods have stopped after the procedure complete.
So age is a very important factor. I mean, to the age.
Okay.
So yeah, 53.
Yes.
Okay, so that she reached the menopause now. So she needs to basically sleep disorders is the main thing. A little bit of estrogen. And what is the treatment that she went through? I missed that.
UFE procedure.
Okay.
Mhm.
So she could take a little hormone always. Now, vaginal and gels, like
Mhm.
spray or gels, are always better, and they help in relieving symptoms. Uh, but not the oral. The oral estrogen goes through the first pass through the liver, and
Mhm.
there are increased chances of thromboembolism. So patients are better off taking vaginal gels or vaginal creams or um, gel applications.
Okay. Um,
That'll help her. And sometimes, if you don't want to take hormone, then you can take like Ambien, something to sleep. That's
mhm.
non-hormonal also, so that might work for her.
Okay. You touched upon the typical age, but then you also said premature menopause, right? How early have you seen any woman going through premature menopause, and
Mhm.
uh, what should she be aware of in terms of taking care of her health?
Yeah, typically I've seen that it could be a genetic thing that is, if premature menopause, their mom could have had it, their sister could have had it, it's kind of genetically. Again, these are the patients who really want to make sure that they have um, the, the vitamin D levels, calcium, because now they're going to have early bone loss,
Mhm.
right? Because it's so earlier on in age. So bone weight bearing exercises, vitamin D, calcium, these are very, very important things for these patients to take. And if they do get symptoms, again, they could go ahead and take uh, a hormone replacement
Mhm.
therapy.
So, is it typically recommended HRT if somebody is in menopause in their mid 30s?
No, not at all. Not unless they have symptoms.
Okay.
Not at all. And even if they have symptoms, go with a non-hormonal method, please. First is that. And then if that doesn't work, then you go on to. And I've seen that these patients, that sometimes they don't even have symptoms of
Mhm.
menopause,
Mhm.
the premature menopause. They're
Mhm.
fine. They have, except cessation of periods, they have no hot flashes, no vaginal dryness. They're good. They're all
Yeah.
okay. But then I encourage them to take the vitamin D, very, very important, and calcium.
Uh-huh. So another question says Western women take HRT very liberally for years. Why the hesitation to prescribe it? What are the side effects?
They've been taking it for years. Is that what it's
Uh,
saying?
the question says Western women take
Uh-huh.
HRT very liberally for years.
Where they are also to be monitored very carefully. So if you remember, I said in the beginning, small dose for a small period of time. But if you're taking it for a while, you should basically have checked your ultrasound, uterine lining, make sure if you have any bleeding to have an endometrial biopsy done. Unopposed estrogen could cause increased chances of endometrial cancer. So that is why we gave an estrogen progesterone combination so that there's an add back therapy.
Mhm.
So the we have these patients need to be closely followed. because you really don't want to take it for a long period of time. Once you'd have, so what I do is I say, okay, take the medications, but like take it twice a week, twice or thrice a week. See if your symptoms go away. If they do, great. Then taper it, taper it off, and see whether you can do it just once a day. Great. Once a week, if you can do it. You don't, then you can take once a week, maybe for 6 months, and then see how you do. So basically, small dose, small amount of time, and then taper it.
Okay.
They don't recommend long-term estrogen hormone replacement therapy. But
Got
you have to be followed by ultrasounds, endometrial biopsy, make that very, very important.
it. Okay. And maybe a couple of final
Yeah.
questions
Yeah.
is over-the-counter calcium and vitamin D sufficient, or is it prescription grade?
That is sufficient, depends on the vitamin D level. So if you do every yearly, do a vitamin D level and make sure it is in the optimum range, you can take that. You can take injectable vitamin Ds too if your vitamin D is very low. So it all depends on the level. And all women, 60 years, they should get a DEXA scan done, bone scan, just tell you what are you moving towards bone loss? Or so that's going to give you some more information.
So when you say you should get these scans done, does the doctor typically mention or prescribe it, or should a woman be aware and ask for it?
You should be aware because it's a screening test. It's a screening test done when you come in after 60 to your well woman exam.
Mhm. Okay. But I'm assuming it is part of the well women exam that these would be recommended by the doctors.
Yes.
Okay.
I mean, this is a vast topic. And so there are a lot of things like, what do you do in a patient with breast cancer, hormonal replacement therapy, with the almost about 30, I think the number of people with breast cancer survivors is almost about 3.8 million at this point in the US. So that's a whole different topic about estrogen hormone replacement in breast cancer survivors, patients with family history of breast cancer. That's going to be maybe a different day, a topic, and we can discuss. So that's also a lot of questions are asked on those as well. But I think overall on this, I would say non-hormonal is the best. Yoga, exercise, and all of that, diet. And if still you don't have any symptom relief, then consider hormone replacement therapy.